Alfred Garfall. I'm an assistant professor of medicine at the University of Pennsylvania, and we've been participating in this phase 1 study of Teclistamab, which is a bispecific antibody targeting BCMA and CD3 for relapsed refractory multiple myeloma. And so this is a class of drugs that has the ability in the form of a pharmacologic agent to induce the kind of massive T cell activation against cancer cells that historically has been affected by CAR T cell therapy. So this, in many ways, the level of efficacy and the toxicity profile is similar to that of CAR T cells, or at least that's the hope. And so this is a phase 1 study of a novel bispecific antibody targeting BCMA and multiple myeloma. The study enrolled patients who were fairly relapse refractory, median 5 to 6 prior lines of therapy, and employed initially IV dosing of the drug every 1 to 2 weeks. And then in the later cohorts, and the data we're presenting at ASH this year, discuss subcutaneous dosing. And that's actually been a really nice, convenient factor for patients, the ability to receive this drug as subcutaneous dosing. And the recommended phase 2 dose that we identified in this study is a subcutaneous dose, 1,500 micrograms per kilogram. And so in this study, we have found toxicity to be, as expected, cytokine release syndrome, similar to CAR T cells in its nature. But fortunately, it's been mostly low-grade cytokine release syndrome that's been manageable. And to try and mitigate the risk of severe cytokine release syndrome in this study, we employed step-up dosing. So patients over a week prior to their first full dose get a series of lower doses and we think that decreases the risk of severe cytokine release syndrome that we might see if we gave the full dose right off the bat.